from across the city, across the country, and around the world who are riding with me. And we're doing it all from Michael Garron Hospital. So it's a pretty good day. How are you?
I'm doing really well. So, first and foremost to you, sir, and to everyone that's riding with you and joined in, and everyone that's donating to such an important cause, a really big thank you for me. You guys are crushing it. Thanks. We're doing really well, and I'm doing well. It's been I'd be lying if I said that this hasn't been a long haul, and we've got a lot of road ahead of us. But we're all in this together, and like I said from the outset, I really believe we got this. We're going to have to work hard and continue to work hard and make some tough decisions, but we're a strong city with a great team, and I have the privilege of leading an awesome team, and we're not going to stop. We're not going to stop until our city's past COVID and on the way back to recovery.
So we've had a few folks, frontline healthcare workers from Michael Garron Hospital, on the line with us today and last night, and one of the big messages they had was, we are in the position we're in right now because folks have been heeding the advice of medical officials, Dr. Davila, our emergency response team, and we are better positioned today than we certainly could have been 6 weeks ago, where we were looking at the numbers on that curve rise and we didn't necessarily know what direction we were going to go in. Can you talk us through your day and leading the task force and what that looks like?
Sure. So let me start where you started, Councillor. I agree with that completely. When we saw the first medical modeling and the first projections of how bad COVID could in actual fact be in our city, it was devastating. And we were told from the start that our ability to come through this as a city would be largely, if not almost entirely, dependent upon what our residents did and how all of us individually responded to this, and the extent to which we respected and followed the advice coming from the medical officer of health. We are doing really, really well. And that is as a direct, in fact, it's almost entirely as a result of our residents and the people in our communities staying home, respecting physical distancing, taking the medical precautions, washing hands, using hand sanitizer, all of the things that the Toronto Public Health have told us. And of course, without any doubt, it is at the hands of the extraordinary women and men that are on the front lines and on the front lines in healthcare. And I've always had a deep appreciation for our medical and healthcare teams, none more than today. So a huge thank you for me. My role in this, I was asked a number of weeks ago, in fact, before the first case of COVID, it was then called coronavirus, before the first case of COVID was even in Canada, I was asked by the mayor and the city manager if I would lead the City of Toronto's response to COVID-19 in a role that functionally for me as a fire chief, we would call the incident commander. And I accepted that challenge, and since that time, I have been working as the City of Toronto's incident commander, leading the response to COVID-19 on a citywide basis. That has given me the unparalleled privilege of working alongside and with some of the most dedicated people I've ever met and ever worked with. We've stood. Our emergency operations center was activated more than a month ago. As you know, we just passed the 1 month anniversary of the first and only declaration of emergency in the city, and we have been going nonstop. A normal day for me is about 18 hours a day. I start about between 5 and 5:30 and have back-to-back command and coordination meetings and calls all the way up to our afternoon press conference, and then we pause for the press conference in the afternoon, and then most of the planning, the review work and planning for the next day and the next segments of the operation happen between 6 o'clock and about 11 o'clock at night. So busy days, but I have nothing to complain about. I'm working hard, but our team's working harder, and I couldn't be more proud.
How do you keep up that pace, though? You've been going at it for months. That is incredible. 18-hour days, 7 days a week. You don't get a day off. I mean, that's unbelievable.
Yeah, the truth is it's hard, and it's physically demanding, and I think it is for all of us. I probably drink more coffee than I should. But the other thing that's really hard, and I've had the opportunity over the past few weeks to do quite a bit of have a number of conversations with people like Michael Landsberg and Sick Not Week and Isolation Nation, and a lot of contributing to the whole discussion around mental health and how difficult it is to be isolated. I'm away from my family. I haven't actually been at home other than for a quick trip to grab some essentials and do some laundry. I haven't been home for about 6 weeks, and I don't envision being able to go home until we're through the response side and into the recovery phase. So it's tough, but if I can just take a second and remind everyone that's watching two things. It is okay not to be okay. It's okay to not be comfortable with where we are. There is nothing normal about being physically distanced. There's nothing normal about being isolated, and it's entirely okay to feel anxious and pressured and stressed and even scared about where we are. That's okay. We got to make, it's okay to make peace with that. The other thing that has become really important for me, and what I would encourage everyone, is really focus on letting go of the things that we are not in control of. We're actually in control of very little of this. Obviously it's a virus that none of us can get our hands on. So I think there's some peace to be found in focusing on the things that we can control, and really focusing on, to the extent we can, staying healthy, eating as well as we can, looking after our own emotional and mental health, so staying connected with our support networks by FaceTime or Skype or Zoom or on the phone or whatever it may be, and really staying focused at the task at hand.
That is such an incredible advice, and I know that you have done a lot of work on the mental health front, and I think we see in moments of crisis like that, the acuity, the critical nature of those responses, and mental health is that much more important. You're right, like this is not something anyone can be expected to be comfortable dealing with, because it's uncomfortable, and just acknowledging and accepting that is so important for all of us to allow ourselves to feel that vulnerability and be at ease with that.
You said it perfectly. I couldn't agree more, sir.
So one of the, I worked at the city before. I ran for council, many different divisions, not always necessarily moving in the same direction. There's a lot going on. It's a big organization. From an operations command center, our first priority is health and safety, but also the city of Toronto needs to maintain business continuity. There's critical and essential services that need to keep happening. How have we been responding to make sure that, literally the trains are still running, the trash is getting picked up, the water is still clean, our shelter system is still operational? How have you been managing so many different aspects of all the things the city does in a situation like COVID?
Well, we, from the start, and I'll say that the methodology and the incident management methodology or incident command methodology that we put in place and are now operating for COVID is exactly the same methodology that is in place and operates inside a mobile command post every time we have a fire or other emergency in our city. So thousands of times a year we're using the same structure. This is just much, much, much bigger. And one of the key elements, in fact, the most important initial aspect of any incident management system is establishing what I would refer to as the tactical priorities, or maybe a little easier to understand as the strategic priorities. We established right from the start in Toronto that our first and foremost priority was to save lives. So the first criteria that we evaluate our decisions against and make decisions in support of is saving every life possible and doing all that we can do to reduce and eliminate the spread of COVID in our city. That's number one. The second is to do everything we can do to avoid overwhelming our healthcare system. And like we said at the start, some of the earlier predictions and earlier models showed the potential for devastating impacts happening in our healthcare system. So our second priority was to avoid overwhelming our healthcare system. And our third priority is to do everything that we can do to protect both the financial economy in our city and the social economy in our city, and do everything that we can do to protect those economies and protect those vital networks so that we can eventually turn the economy back on, we can protect employment to the greatest extent possible, and return our city. So we're operating an incident management system now. It is the largest I've ever managed. It's actually the largest incident management system I've ever seen. There are more than 40 different sectors, task force groups, and teams that are working on a 24/7 basis. And like you said, that's in support of every frontline critical and essential service that we deliver in the city, and all of the supports that need to be there. Of course, prioritizing the health and safety of our workforce, and achieving our overarching and principal goal of saving as many lives in our city as we can. And that's why our entire city team gets up every morning, and that's what we're thinking about when we go to bed at night. And I know I speak on behalf of the thousands of people that are committed to this effort, that we're not going to stop that until we've achieved that goal, and until we're focused and squarely into the recovery and rebuild phase.
That's incredible. What a tremendous amount of work. Now, one of the questions everybody asks, I'm not going to ask you about when this is going to end, but I did want to ask you what you think the city might look like, or what are the next few months at the city? Is the EOC going to stay open? What do you think, are we going to see any sort of fundamental changes in the way that we do things? If you were to look down the road 6 months, a year, how is this going to change the way we do things, and how will it not change the way we do things?
Well, a lot of that, to be candid, a lot of that I think is yet to be determined. But from where I sit in the the coordination or the command meetings I sit at, I don't think there's any doubt that I think our globe is going to look and act and feel different than it's ever felt before, and that, of course, our entire world, our country, our province, and our city. The impacts of COVID-19 undoubtedly are going to be extraordinary. I think they already are extraordinary, and I really think that as we transition and continue the response, but ultimately transition into the planning stage and then the implementation stage for recovery and rebuild of the economies in our city, I think it's going to cause all of us to really rethink the way that we deliver services, the way that we engage and behave as residents and citizens. And maybe from a more emotional standpoint or a more personal standpoint, I have a lot of conversations with people that lead me to think that I really think that a lot of folks, and me included, are probably going to go through a period where we reevaluate what's actually important to us, and what maybe some of the things that we the pursuit of different things that might not be as important now as they may be going forward. And honestly, I think those are things like appreciating our freedoms, and appreciating the ability to spend time uninhibited and unrestricted time with family and friends and those we care about. There's that adage, right? We don't know what it's got till it's gone. And I think that I would not be surprised at all that our city council, including yourself, and our provincial elected officials and federal elected officials, and globally, I think that there will be a really hard set of decisions and discussions about what our future looks like. And the city's launching, building an extremely robust recovery and rebuild team, and I'm excited to see that happen. My role, my commitment to that is I will be the formal link into the response and emergency operations center side of that as the recovery team starts to lead the response. And then, of course, I'll provide whatever assistance I can on behalf of the entire operations side of the equation into the rebuild and recovery. So we're all looking forward to that day.
Well, it is certainly a moment for putting things in perspective and deep reflection for all of us. Listen, Chief Pegg, I want to thank you from the bottom of our hearts. Getting a lot of love on social here, in our Zoom room, and on the Facebook Live. We're so grateful for everything you're doing, the long hours, and the poise and the leadership and the professionalism you have under duress and crisis. We're so grateful. Everybody really appreciates it.
Well, thank you, and to everyone that's watching. I have an extraordinary privilege. I've been given the immeasurable privilege of being asked to lead this initiative and to work with such an incredible group of people. And I really appreciate those comments, sir, and I will receive them and reflect them immediately back to our team. I work in an awesome team. Here, I got to show you this. See this?
Conquer COVID-19. All right.
That's what it. That's why we're doing all of this, and we're not going to rest till it's done. So keep riding, sir. Keep raising money. To all of our healthcare people out there that are keeping people safe and saving lives, I love you guys. Carry on.
All right. Thanks so much, Chief. We'll speak with you soon. Cheers.
Okay. Cheers.
What an incredible guy and an incredible response. City of Toronto is so lucky to have Chief Pegg at the helm. So I'm going to be jumping off here for a few minutes for a few phone calls, and then we will be back with a very special guest, Leah Kirchman, professional cyclist, riding world tour, based over in Europe, talent from Winnipeg, calls Dundas, Ontario home, just an absolute rock star. It's we're really lucky to have Leah Kirchman joining us, so that'll be at noon, so check out the live stream for that, and we'll be back in a few.